It's been a long path to sobriety for self-declared bogan from the bush, Shanna Wan.
It began as a party girl, trying to fit in, and I was very socially insecure, and alcohol made me less so.
Over time, that dependence turned into a decades-long addiction. Her rock bottom was waking in hospital after a drunken fall and realising her choice was to change or die.
Bush people are notorious red flag drinkers, and we call ourselves legends for doing it. And our mates are dying because of that mentality.
She did get sober, and her struggle inspired her to launch the charity Sober in the Country to help others.
Our job here is simply to make it okay to say no to beers in the bush.
It's a message she travels the country to spread, and it's evolved into a widely recognised social movement. While attitudes and consumption are slowly changing, data shows Aussies still drink at worrying levels, particularly in remote areas. The geographic isolation makes things harder, and often social connections centre around booze, with the local pub acting as town square.
In any rural community anywhere, they are very much a big part of the social structure of the community.
Paul's operated this pub for 27 years and isn't convinced grog is a major problem, but rather it's a way for people to unwind.
They're just blokes, they're workers, so they all work hard and drink hard.
But for some, it can become a problem, an addiction requiring detox and rehab, and some of those people will need medications and monitoring during their withdrawal. That kind of support is hard to come by in the bush.
Alcohol is one of the most dangerous drugs to detox from. Going cold turkey can lead to seizures and death.
The lack of services prompted him to create Clean Slate Clinic, which helps patients medically detox from substances at home with daily telehealth appointments. It's a concept he's been running successfully in metro areas for years, and now he's taking it to the bush.
How have you found the process so far? We do a comprehensive assessment of somebody's drinking to really determine whether they need a medicated detox.
Western Queensland is one of the trial sites, the other is in Western New South Wales, and the program works alongside existing services like those provided by Outback addiction counsellor Nikki Waldemuth.
Alcohol is the primary substance of concern that we're noting with our clients out here, and I think so it sits at about 50% of our clients.
She often travels to remote clients and thinks home detox makes sense.
Whether it's accessible or a possibility or an option to travel away.
You can remain anonymous in your community and just continue to, live day to day.
The program will be assessed early next year, but already there's been a strong interest. Work is also underway to tailor the program to the needs of remote Indigenous communities, which health experts say could bring about meaningful change, so long as it's done in a culturally safe way.
Given that Western Queensland's got the second highest Indigenous population proportion behind Northern Territory, it's critical to meet the needs of our First Nations populations.
I think that had it been presented to me as an option at a certain point in my scale, it would have been a game changer.
And she hopes it will be just that for many others. Penny Timms, ABC News.